Welcome to Dime's end of year event with Jennifer Goldsack and Halle Tecco, the author of Massively Better Healthcare. Today, these two will dive into today's discussion around where our healthcare system is today and how do we design a system that's massively better, more affordable in the next 5 years. Many of you are building companies, running health systems, leading product policy teams, working at payers. So we hope this is an actionable discussion and encourage you to submit your questions so we can address them in the Q&A. I'm Margaret Malone. I'm an investor at Flare Capital. Flare Capital is a venture firm dedicated to investing in early stage companies. We're at the intersection of healthcare and technology. Before we jump in, I want to share a few housekeeping items. First, the session is being recorded, and we'll make the slides available on Dime's webpage after the session. We ask that participants please not transcribe this webinar. And lastly, I mentioned this before, we will do a live Q&A at the end. So please submit your questions throughout the discussion, and we will pull those up at the end. So with that, I'll set the stage with a few quick data points on where we are as we tee up the discussion with Halle and Jen. So as everyone knows, the healthcare industry remains under pressure post-pandemic. We all know the top line numbers, but the US spends about $5 trillion on healthcare, close to 18% of GDP, and that share continues to rise. It shows up in rising premiums, higher deductibles, and very real trade-offs that we're all facing. Recent legislation and regulation are focused on really curtailing that spend, and we're watching and then seeing kind of a wave of emerging policies try to tackle that as well, including tariffs, site-neutral payments, 340B, changes to Medicaid enrollment and provider taxes as well, that are truly reshaping the incentives across the system. Kind of layer onto that rapidly aging population, rising burden of chronic disease, and the pressures on payers, providers, and innovators only intensifies. Nevertheless, the enormous challenges, headwinds also create opportunity. And we're seeing that at Dime, and I'm seeing that in my seat at Flare. So advances in AI, automation, shifts in more efficient sites of care, advances in medical science, and care model innovation can all help reduce the national health expenditure. And they estimate that could be an impact of about 10%. With that, there's also augmented workflows and kind of an opportunity to reshape how care is designed, delivered, and paid for. And we're already seeing some early proof points, AI tools that are taking hours off of clinician documentation. We're seeing virtual and home-based models that can safely shift care to lower sites or lower cost settings. We're also seeing data-driven approaches that are finally allowing us to target kind of people that need care the most, and we can get that in a timely manner. So the question really no longer is there opportunity? It's really, how do we scale that opportunity? How do we make sure that it works? We align incentives, and when can we start? We're seeing that leaders must, urgently restructure to survive in the evolving landscape, but we're also seeing kind of an emergence of leaders who are really thinking about how to design and redesign and reimagine what is possible. So I'd encourage, this is a moment to radically reimagine our industry, refocus our efforts on building a system that is focused around affordability, quality, better health outcomes, and better patient experience for everyone. As part of our efforts at Dime, which Jen will walk us through, we've organized select opportunities to bring together key leaders from across the ecosystem and sit down and talk to them about how to build a better healthcare system in the next 5 years and where to start in 2026. So I'm very excited to host this discussion with two fantastic leaders who sit at the intersection of these forces and innovation, who can help us navigate. So kind of back to the agenda, Jen will start by sharing some insights as we continue to champion Healthcare 2030. And then she and Halle will dig into some of the key themes from Massively Better Healthcare, touching on themes that are essential for anyone looking to refocus our efforts and make our healthcare ecosystem both sustainable and substantially better in the next 5 years. So as I said before, we'll close the session with a live Q&A. So encourage the audience to please submit your questions throughout. And I think our hope is you all walk away with at least one concrete idea that you can bring back to your teams. So with that, I will pass the mic over to Jen. Jen is the CEO of Dime. We're really thrilled to have you and to share your opening remarks. So Jen, over to you.
Fantastic. Margaret, thank you for that tremendous overview. And thank you too for your support, your leadership, not only in your day job over at Flair, but for the leadership, the vision, and frankly, the support you give me, Dime, and our whole community through your role, your leadership on our board here at Dime. So it's tremendous to welcome you all to a year-end webinar. My name's Jen Goldsack, just as Margaret said. I'm the founder and CEO here at the Digital Medicine Society. For folks who don't know us, we are a global nonprofit, and we essentially exist to help all of the individuals, all of you, all of the organizations, both on the tech side of the house, the clinical side of the house, who wake up every day to try and do hard things to make sure that as we digitize healthcare, we drive towards a future that's sustainable. And it's always a bit overwhelming to do a year-end webinar on December 2nd. I don't know if anyone else's to-do list before the end of the year still looks like mine, but we are going to lean into a reflection on the year so far. And, you know, Margaret, when you were able to set the stage for us, it's been an extraordinary year. It's been a year of policy changes that I think few of us could have predicted. There's been an enormous drive with rapid innovation, particularly with AI. It's been consuming enormous amounts of dollars and also driving, in terms of innovation, a world where there are the innovators with resources and those without. And of course, we look at and we think about the patients that our industry exists to serve and how many of them are going to struggle to access healthcare going forward, becoming even more difficult than it is before, as we look at changes in health insurance, as we look at closures in rural healthcare provider systems. We have a lot of work to do. And we talk a lot now at Dime about Healthcare 2030. What we realized this year as we were observing all of these changes, partnering with all of you on the line who are doing extraordinary things every day, is that Dime could not continue doing business as usual. We had to think differently. We had to advance a vision, a blueprint for a future of healthcare that's sustainable. And so when we launched Healthcare 2030 in September, it was a bold vision. And many people said to us, gosh, 2030, is that the right timeline for you to be looking at driving transformative change? And our answer to that was yes. We believe in this community of change agents who can do extraordinary things, and we believe we cannot wait. We have this moment where technology offers us enormous promise, and we have a fleeting opportunity to make sure that we deploy it to get it right. And I'm absolutely certain if we were to talk to CFOs at healthcare systems, at life sciences companies, and, you know, even within our payer colleagues, who we always used to think of as being sort of the bastion of people who didn't know how not to make money, this is a challenging time. We have to behave differently. And so the vision for 2030 that we proposed at Dime, taking into account the sort of technology drivers of data, compute, communication, connectivity, we need to harness them to think about prevention. We cannot continue to sit in the clinic waiting for folks to present already sick with symptoms likely to have worse outcomes and be more expensive than if we were able to catch their conditions earlier. We have to think about personalization. Part of my journey this year has been dealing with a late-stage cancer diagnosis, and as I'm going to say it, young woman, you know, sitting there opposite an oncologist who can only tell me data as we make sort of decisions, life or death decisions that are for older patients, male patients, folks who don't look like me at all. I can tell you right now that what I have experienced is nothing compared to many underserved populations. We have to do a better job with personalization. Now we have flows of data. We are replete with data. We have to hold ourselves to the bar of measuring health outcomes, not continuing to measure process. And we have to be doggedly focused on sustainability. We have to think about delivering care that's financially sustainable for individual families and for society. We have to make sure that our industry is sustainable for those clinical experts who continue to do extraordinary work every day as they care for us. And we have to think about the sustainability of innovation. We have to generate ROI for these tens and hundreds of billions of dollars that are being poured into trying to do something differently. It has to return, or those funds will dry up. And so before I have the privilege of talking to Halle, and it's just such a wonderful conversation, and her book is extraordinary, it is going to help all of us help realize that vision of Healthcare 2030. I actually want to make sure that we at Dime are holding ourselves accountable for driving towards that vision of Healthcare 2030. So I want to share just a few successes we've had since we launched Healthcare 2030 in September, just 2.5 months ago, and then look ahead briefly to what we are going to be working on in 2026 to continue to advance that vision. So shortly after the release of our impact thesis, we launched the playbook for implementing AI in healthcare. This is an extraordinary resource and one that cuts through the noise. And I'm so proud of this team because what they realized was we can spend all day talking about the math and the model, but the reality is we need to meet our healthcare systems, our clinical colleagues, the administrators, the tech folks at healthcare systems, trying to all keep us safe where they are to offer actionable sort of real talk resources for how you can be successful and drive a double bottom line, success for patients and the people who care for them, and the sustainability of the system with these resources. We matched that with 2 tremendous new education courses within the Digital Medicine Academy, specifically intended for individuals working at low-resourced healthcare systems, trying to think about how can you capture the value of this AI revolution? How can you make sure that it's working for you, your colleagues, your systems, and the patients you show up to work every day to serve? We've been busy continuing to contribute to government efforts. We have our federal comment toolkit where we advocate and hopefully make it possible for many of you to be responding to the government's call for insights from outside of the Beltway. We've offered thoughts to OSTP, to FDA as it relates to how we regulate AI. We've also done an awful lot of work. We've been co-authors on letters as they relate to continuing to sustain telehealth and virtual care without having to tack it on with a vote in the Senate and the House every single year. We've built on work we launched earlier this year focused on hospital at home, and we've recently started work on addressing aging in place of choice in the digital era. And if we think about what our colleagues at CMS and ASTP ONC are doing to make sure that Medicare beneficiaries have access to the best of technology and aren't an afterthought, this work is so well aligned and incredibly powerful. We're also welcoming new partners to projects looking at direct-to-consumer pharma. We recognize that this is emerging as a care pathway. We see patients flocking in this direction. We want to make sure that these pathways are optimized for the patients that we're here to serve. We improve access, and we sort of move past some of the broken characteristics of medical products, the PBMs, so on and so forth. We're also absolutely committed to preserving rural hospitals. We want to make sure that regardless of where you live in the United States, you have access to the very best of care. Digital will help. The continued existence of rural hospitals is also absolutely essential. And we've also done some work, which is particularly sort of important to me right now, around de-risking cytokine release syndrome. So we think about the emerging class of oncology drugs, IO therapies, CAR T, but we think about the burden of being able to access either those trials or those medications, even once they're on the market, because the current protocols exclusively have you as an inpatient. I was an inpatient cancer patient for a month, and it was awful. And the work that we have done and that we are continuing to do is going to make sure that we improve access and we can allow every single person battling cancer in the United States to get the treatment they need while they are still safely among their support sort of network, while they are still in their community. And I hope that this gives you a sense that we are incredibly committed to being successful in our pursuit of Healthcare 2030. A 5-year timeframe is bold, but I believe that with all of you on the line and with our tremendous team, my amazing colleagues here at Dime, that we can do it. And before we move into our discussion, I just want to tease a few things we have coming down the pike in 2026, because the work cannot stop if we are going to be successful in this movement for Healthcare 2030. We're going to be launching in January with our FDA colleagues a how-to guide, a comprehensive one-stop shop for anyone who is wanting to use digital drug development tools around the world. We are going to build on the work that we launched in January of this year, where and in fact, Halle, it was as a result of data that we saw out of a Rock Health report, where we saw that there was such a paucity of investment in our most vulnerable population, in our children, when it came to the digitization of healthcare. We created a playbook. We're now working on pediatric rare disease, and the work on pediatric rare disease will continue as we launch these resources and a follow-up project in the new year. We're working on patient-generated health data as a result of a workshop that we co-hosted with colleagues at FDA. We want to think about how we can use not just data in the electronic health record, not just claims data, but data that best reflects our experience of disease in our everyday lives as we evaluate AI going forward. We are absolutely committed to making sure that we address the mental health crisis that we are experiencing, both through our ongoing work, which will launch early in the new year, and planned follow-up work. Earlier this year, we had a tremendous partnership with our colleagues at the New York City Department of Mental Health, Public Health and Mental Hygiene, and we were able to codify the extraordinary work they did to de-implement harmful race-based algorithms across all of the federally qualified health centers and safety net hospitals in the 5 boroughs. We are now working on a planning grant for an implementation study to replicate that in California, which hopefully will be the blueprint so that we can remove these algorithms nationwide. We are going to continue to commit to making sure that we have the evidence to back up the use of new technologies following the launch of our integrated evidence plans. And we are going to continue to make sure that we can justify, not just in terms of the improvements on patients' lives, but to the CFO through a business case, that the way that we are innovating in drug development is returning to a bottom line, as well as the patients that we exist to serve. And to sort of wrap, I also want to highlight the ongoing value of our DIME seal as we evaluate medical products, as we think about when there are 300,000 plus software products on the market, how could we ever determine in a way that's cost effective, what's high quality, what's trustworthy, the role of the DIME seal? And as we think about the forthcoming launch of the Medicare app library, as we think about the access model that was announced by CMS yesterday and the marketplace that they are going to establish, ways to identify trustworthy digital health solutions is an imperative. And the DIME seal, I think, will continue to be an increasingly important tool filling that role. And so again, I bring us back to Healthcare 2030. I believe that it's possible to fundamentally change the way we care for people in the digital era. I believe we can and we must do this by 2030. And Margaret, I'm going to hand it back to you in just a second to introduce Halle, who I'm just delighted is joining us and who wrote this extraordinary book that I think should be sort of at our fingertips as we all drive towards a sustainable future. It gives us courage, it gives us tangible examples, and it gives us clear direction on what it's going to take to be successful. So Margaret, let me hand it over to you to introduce Halle.
Thanks, Jen. And Halle, we're just so happy for you to be with us today. I will do my best to capture your background, but you have such an extensive career. It's just really an honor to have you. So for the audience, Halle is an entrepreneur. She's an investor and educator, passionate about fixing our healthcare system. She's a co-founder of Co-Fertility, where she's helping reimagine egg freezing and egg donation experience. And she previously founded Natalist and Rock Health, one of the first venture funds dedicated to digital health. And she, in addition to building and backing companies, she also teaches the next generation of healthcare leaders at Harvard Medical School and Columbia Business School. She's the creator of The Heart of Healthcare. I encourage everyone to check it out. And she's releasing her book, Massively Better Healthcare, The Innovator's Guide to Tackling Healthcare's Biggest Challenges, and we'll discuss that today. Across all of her work, Halle's become a trusted, influential voice at the intersection of healthcare, technology, and equity. She's a leading advocate for driving meaningful and lasting improvements in women's health and the broader healthcare system. We're thrilled to have you with us today, Halle. We were laughing before everyone else joined. I met Halle several years ago in the Oxyon boardroom in New York, and it's just really a pleasure to be reunited in this capacity. So looking forward to the conversation today. Welcome, Halle, and I'll turn
Thank
it
you
over
so
to you and
much.
Jen.
Yes, thank you. And for everyone that helped put this event together, no easy feat. So thank you. Thanks for having me. And congratulations for all the incredible work that Dime is doing. It is so impressive, so needed. And let's just like move forward together with all these great frameworks we have.
Fantastic. And Halle, I'll echo Margaret's thanks for you joining us today. And I'm so excited to have the opportunity to discuss your book. I think the way that it's written, it's incredibly accessible, it's incredibly engaging. You share your own personal stories alongside those of other sort of leaders who have done truly hard things in our industry. But, undertaking writing a book is no easy feat. What was it that motivated you to put massively better healthcare together, and why now?
Yeah, well, thank you for the kind words. As I was saying, it was actually really fun to write. I and really enjoyed the process of writing over the last 2 years. And now I'm in that nerve-wracking stage of wondering if people will really enjoy reading it and benefit from it. I will take your words as a testimonial. I will add it to the website. I really appreciate you saying such kind things because that's really my goal is to take everything that I've learned over the past 15 years from founding and running Rock Health, from tracking every digital health deal, backing over 50 companies, publishing industry reports, teaching, all of that, like all of these lessons, all of these interesting stories that I was able to kind of pull out and pull together. I really wanted to share with the world. And I talk, as you know, in the book about kind of going from being an outsider who didn't feel like I belonged, didn't feel like I had the right to do anything in healthcare because the way some of the COG, the cranky old guard, treated me. And now I'm an insider. And writing this book was a way of using that insider vantage point responsibly and welcoming outsiders in healthcare. I say this all the time, but we need as much talent as we can get to solve some really big, tricky problems. Not only do we need that talent, but I think that there's a lot that outsiders can bring to healthcare and things that they learn in other industries that we should be open to hearing from and not creating barriers to them coming in, learning, and giving it their best effort. So that was kind of why now. I will say it takes like publishing is just so slow. I actually turned the book in earlier this year in February. It will be
Mhm.
out, in another month or so. And publishing is just so slow. I need to like reread it myself. It's been a while, and I'm sure there are some things that I will want to update. But the cool thing is, I will be able to update it every year, and so hopefully, it can be just like this really great resource and guide for people that want to join healthcare.
Fantastic. And first of all, I think that your experience will resonate with anyone who's familiar with publishing scientific papers. And the turn of phrase I always use is, we're moving at the speed of science. So there's
Yeah.
that.
Yes.
Halle, it's so interesting that you talk about this notion of insiders and outsiders. And now that you are, truly an insider and a true leader in our field, you've been just phenomenal at setting the bar for all of us in terms of paying it forward. But, this notion of insiders and outsiders, and early in the book, you have this story where, you're fundraising to launch Rock Health, you're sitting across the table from someone who couldn't have been less interested in hearing what you had to say, very defensive posture, and then asks you, who are you to do this? Doesn't even engage with the idea. It's an immediate ad hominem attack, and it sort of sets the stage for this notion of insiders and outsiders. Do you think we're still in that situation today?
Oh, absolutely. I don't think that has changed at all. Even though we now have ample examples of change that has been driven by people who at one point were outsiders. But I think the whole notion of insiders versus outsiders in healthcare, it makes no sense because we all are insiders. We all, as human beings with bodies who have experienced the US healthcare system as patients, that makes us a stakeholder in the system, and that gives us the right to help change the system. So anyone who's on their perch that feels like only they have the power and right to make change and do things, and everyone else is just noise. To me, that is like that thinking needs to go away. Unfortunately, it hasn't gone away, and I think, I could almost argue that it's gotten worse and that the underlying power dynamics haven't disappeared. If you look at just like women in the space, and we know that women make up the majority of healthcare purchasers, and we experience pregnancy early on in our lives, meaning we have this enormous healthcare experience that has been largely ignored in clinical trials, has not really seen as much innovation. And we're still getting a paltry amount of funding, not just for women's health companies, but for healthcare companies overall. And in some reports, we're actually seeing that the number is even declining. And we're also seeing that capital is getting more and more concentrated. So we're seeing fewer women at the helm of large companies that are getting billion-dollar valuations, that are IPOing, that are exiting. So I would say that unfortunately, it's not different now. People that have been cast as outsiders are still facing those same sort of dynamics, and I hope that we can together change that.
And Halle, I might chime in with a follow-up question to that, because I know you've written on
Yeah.
this topic as well. Just kind of advice that you have for outsiders, like navigating either the financing
Yes.
landscape, but also as builders and how they tell their story.
Yeah.
Just curious.
Yeah. Okay. I think just knowing this when you get started is really helpful. When you start and present a new innovative idea, people are going to think you're crazy. They're not going to believe in you. They're going to give you negative feedback. And you just keep going, and you figure out what parts of the feedback are actually helpful, what is just noise, and you keep going. And then like a year later, a couple people are like, oh yeah, this is really interesting. And you get kind of these early backers. And then it's just a snowball effect. And eventually, like everybody kind of comes around and it becomes the norm. And we see this everywhere in healthcare, things that seem like just like Pernuvo is a great example. And I had the Pernuvo CEO on my podcast, and just talking about how he overcame all the initial skepticism. And not to say that universal MRIs without any medical indication is the right thing from a public health standpoint. But do I believe that patients have the right to have more data on their bodies, especially if they're willing to pay out of pocket for it? Sure. I don't think we should be having roadblocks to people having more information about their bodies. But how did they actually go from having a lot of people kind of just really taking down their idea to kind of now it's becoming part of perhaps something that a lot of people are doing, and obviously their growth has justified that. So I think that that would be my advice, which sucks because you kind of just have to endure it. But knowing that you're going to face that, and knowing that you eventually do change hearts and minds, just stick with your mission and your core beliefs and keep rallying folks around you. And we face that also at co-fertility a ton, right? Egg freezing. Not everybody thinks that egg freezing is something that women should have access to. And you just need to like really show that you're in it for the long haul. You're going to make the right decisions. You're going to be an ethical leader. And all of that will just kind of endure, and people eventually do come around.
And Margaret, I'm so glad that you asked that question. And Halle, I think your advice is so powerful. And as I reflect on, the hard work that we all do every day, one of the things that I find gives me energy is the extraordinary people that we work with, the people who do dig in, the people who go through, funders or, other sort of incumbents, for want of an expression, looking at you like you've got sort of three heads and having the courage to keep going because you are absolutely determined that you have something to offer this industry that exists to care for people, is sort of one of my favorite things. And one of my favorite things in the book, Halle, is you have a turn of phrase that, healthcare is hard, and hard can be the differentiator. And you sort of just gave us some insights into, one way that if you're able to sort of persevere and sift through the noise, take what serves you, take what makes you better. Give us some other sort of insights into how we can leverage healthcare being hard as a way to help us be successful.
Yeah. And absolutely, I agree. My favorite thing about working in healthcare is the people. It's so true. I've never met more passionate, mission-driven folks. And I really admire the grit and drive that founders who face impossible challenges up against the healthcare system, and they continue to endure because they really believe in the mission. So agree with you there. So in terms of the idea that hard is your moat, I think we all know how hard it is to build in healthcare. And I think if you flip the script mentally and think about hard being your moat, then you can be really strategic about it. And thinking about all the regulatory hurdles you have to climb, the infrastructure you need to build, the processes you have to put in place, the flywheel you have to get going. These are things that keep the get rich quick folks out of the arena. And so they do end up year after year, you're able to build out more of this hard infrastructure and process that makes your product, your service just increase in value over the years while fewer competitors can actually come in and replicate that.
I really like that. And it's also a really powerful reminder for us all to keep front of mind when you're in those hard moments that actually this is the way you differentiate yourself. This is why what you are doing cannot be replicated, cannot be commoditized. That's why it's special. And I think, Halle, that's sort of really powerful.
It's hard. The one thing I will say, it's hard because it's never been easier to start a company. And so a lot of people are like, just testing things out and wanting to kind of have like quick vibe coding sessions and start companies from that. And I don't know, I mean, you can do a little bit of that in healthcare, but it really takes, like, to do it right, there's just so much work and there's so much piping that you need to build. And so, yeah, as you're doing it, as you said, like, just keep on reminding yourself, like, this is actually what's going to set us apart. This is our moat. Hard is our moat. And that's going to be kind of what helps your company succeed. And it only compounds over time.
And Halle, you go a little bit further than that in the book because you offer up these sort of 4 rules to serve as sort of guide for all of us. And, I think they link really nicely to the title of the book, right? Massively Better Healthcare. And I love this because I think, to your point around how easy it is to start sometimes we see these efforts that sort of nibble around the edges of this enormous need for true transformation. I know that's a sort of overused word. Tell us a little bit about how you envisage the readers of your book using the 4 rules to drive towards truly massively better healthcare.
Yeah. Well, I don't want to give it all away because I want everybody to buy the book and read it or listen to it. But basically, I've taken everything I've learned working with founders, both successful and unsuccessful, because oftentimes our biggest lessons are from our mistakes. And I distilled it into kind of 4 overarching lessons, and each one has a lot of little pieces to it. But I believe that for me, kind of these 4 buckets were the main takeaways. So rule number 1 is working from the inside out, not the outside in. So instead of starting with like a shiny technology and hunting for a use case, or we say like a hammer looking for a nail, you become what I call an anthropologist of healthcare and really immersing yourself in the daily struggles of the people that you're trying to help. So if you're building hospital software, you better be in the hospital, watching what the workflow looks like every day. If you're helping patients with a certain condition, like if you don't have it, then you need to bring in the folks that do and learn from them. And that's how you build solutions that actually solve problems and bring tangible results instead of just adding complexity and cost. The second rule is to align the margin and the mission. And this is something that I've been advocating for many, many years. Our system, as we all know, is so full of misaligned incentives, and we don't want to add to that. There's so many organizations that profit from us not getting better. I share some of the examples in the book. One being fertility clinics. And actually, if they don't get you pregnant, you have to do cycle after cycle like I did. I'm actually a more profitable patient than someone that they help. And so, this rule is really about restructuring those incentives, calling out where they're misaligned, but you really want the margin and the mission to become 2 sides of the same virtuous cycle. So you have financial sustainability, but it's rooted in actually improving lives. Otherwise, like, you just get into what we call the icky zone, and you're making money from actually keeping people sick. And the example that I go into there is Juul, which started by trying to create a smoking cessation product, but ended up getting teens and young people hooked on tobacco, people that wouldn't have smoked otherwise because public health in the US did an extraordinary job getting people to not smoke. But then all of a sudden, Juul was making money from this group. And you could see from their ads, and Stanford has done tremendous research on this, but you can see from their ads, they were targeting young people. And so they were making money by getting people hooked that weren't hooked before. And so that's, just one example, but making sure that you avoid the icky zone and find the sweet spot where the two things, the margin and the mission, are aligned. The third rule, which really aligns with the work Dime is doing, is to be a good steward of health data. And in the book, I point out that healthcare data is simultaneously underused and misused. Most of it is like locked in silos. We're not sharing it in ways that can move healthcare forward. Yet it's also a prime target for cyber attacks. So we're really misusing and not protecting data the way we need to. And so when I say be a good steward of data, that means treating it as a moral responsibility, protecting it like it's your own, and using everything from like qualitative feedback to real world data. And I share exactly how to do that, but making it interoperable, using it to improve care, to empower patients, to accelerate research, all while kind of keeping people's trust in sharing that data. And then I guess the last rule, can't forget the last rule, which is investing in evidence. And this is really, this is one that I think a lot of folks wait until a lot later to do because it takes time and money often, but you have to kind of think of investing in evidence early on, and something that's not really a one and done thing, but kind of built into your culture as a company. And it's a process that grows, and you can continue to invest in it alongside investing in your organization and growing your organization. But this is everything from collecting qualitative feedback from your customers to partnering with academic medical centers to get real world data to show that you're actually moving the needle on the quadruple aim, but kind of being able to show that like the proof is in the pudding, and having actual data that you can use to win folks over is really important, and doing that early on. Those are the four rules.
I when I was sitting with them, when I was going through the book, and you have examples around them, it's all sort of very tangible, and it's also practical. This is not this sort of like esoteric sort of, guidance, and then good luck to you. You really are giving people sort of the tools they need to move forward. And I particularly appreciate the focus you have. I think it's in the second rule on the double bottom line. We talk about that a lot at Dime. It shouldn't be either or. It has to be a yes and. We have this opportunity. We have to spend our time, our efforts driving towards that double bottom line. And I think the examples that you give and the coaching that you give, frankly, in the book is really powerful there. And then as you talk about sort of the evidence piece, and I was sort of chuckling as you were saying it, now knowing the timeline of all of this, right? You're advocating for sort of evidence. You're talking about how we now have access to data that we haven't before. We have a responsibility to, show up with receipts. And I'm thinking about what CMS announced just yesterday with the new access model, where they're going to provide pathways for, digital healthcare providers to come in, be part of this marketplace. The traditional providers will get a co-management fee. They can work together. And they're going to be held to account in terms of you have to be delivering, you have to be performing. This is a outcomes-based reimbursement model. We've been talking in digital for a long time about the fact that we believe we're better. We offer better outcomes. We offer access in ways it hasn't been able to, sort of deploy previously within our system. Now there's that opportunity, and anyone who's been following that fourth rule, who has said, the practice of medicine is an evidence-based endeavor, and we're going to prioritize that, are going to be winning as a result of this new sort of government movement, I think.
Yeah, totally. Jonathan Slotkin wrote a really phenomenal piece today about Waymo, self-driving cars, and the impact on public health. And I thought that was a really good example because when we think about AI in healthcare and AI becoming able to treat, what people say is like, well, then who's accountable? Who's accountable? And I was reading this article and I was like, wow, Waymo's accountable. They're actually now publishing their data on accidents and showing that it's tremendously more safe than than a human driving a car. And so how does this kind of play out? We'll probably see insurance companies that are, I mean, they need to bring the cost down, but insurance companies that are giving, very different pricing to folks who have autonomous vehicles. And so the market hopefully will kind of go in a direction where this makes sense and we can avoid all those avoidable deaths. One of the leading causes of death in the US is car accidents. But who's accountable in that? It's like Waymo's accountable and they're actually sharing their data and being transparent about it. And I think the same can be said within healthcare companies. I hope that we can see AI doing some prescribing because what we're seeing right now at a lot of these, I don't want to say digital pill mills because I think they're great companies like Hims and Roe, but like the doctors that are behind there looking at these like short little screeners and saying yes or no to a drug, like those are rules-based. That's rules-based work that we can really bring the cost down if we allow digital health to do it versus a human. There are places where it makes sense. And the biggest thing that I hear is like, but who's accountable when something goes wrong? Well, the company is. Like in our companies, we need to be willing to not only share the data of our outcomes, but also be responsible for when things go wrong.
I couldn't agree more. And funnily enough, I had the privilege of co-authoring a National Academies of Medicine report earlier this year with a group of extraordinary colleagues looking at generative AI in sort of health and medicine. And one of the things that I pushed pretty hard for, and the team was very open to, was let's actually put a race in for who is responsible, accountable, who's sort of
Totally.
communicated to and or who collaborates and who's informed. Yeah. And it was a really interesting exercise. And we looked at stakeholders across sort of healthcare system executives, across individual clinicians, across sort of regulators and manufacturers. And it was almost all the way down the line. It was the clinicians who currently are shouldering the majority of accountability. And, let's sort of use that as a bit of a pivot. You talked about not needing to avoid digital being a hammer in search of a nail. And sort of 2025 has been characterized by health AI consuming an enormous amount of oxygen in the innovation space. I'm sort of curious on your take for sort of where we are with health AI and, how close are we to running the risk of a hammer in search of a nail here?
So great question. I would say, kind of going back to the accountability piece, I feel like startups are so well positioned because the culture of transparency is so much greater within the tech community than within the healthcare community. I mean, you saw how hard it was to get hospitals just to list their prices. Yeah. like I think that had to become a law, and still not everyone is doing it. In healthcare, we do not have a culture of transparency. We have a very paternalistic system. And in tech, for all that is wrong with it, at least there's a culture of open data and evidence and transparency that I think we can really tap into in digital health and ensure that we're bringing that culture with us versus bringing kind of the old, healthcare culture with us. In terms of a hammer looking for a nail, I mean, I think there's just so much opportunity within healthcare for AI that, like, of course, there's going to be some things that were like silly and didn't work out, but they're going to be even more that will truly rip out costs and change things. And we're already seeing it, which is really impressive. It's funny because I sometimes find that, the incumbents are even more guilty of trying to fit a shiny object into their problem set. And they want to be like early on using AI or VR or whatever the flavor of the year is. So instead of like really diving into their problem first and assessing the potential set of solutions, they kind of build from the outside in. And it's, ironic because they, presumably know the problem better than anyone else, but are sometimes just wanting to be ahead for whatever reason. Maybe it's their board is like, you got to get on AI. And so they kind of just like put it on their checklist and do it. But yeah, I don't know if that answers your question. I feel like I kind of rambled there.
No, it really does. I think you sort of get to the heart of the matter. And I think you're exactly right that oftentimes we sort of pit the clinical teams, the incumbents, if you like, against sort of the disruptors, the innovators. But, brilliant innovation can and often does come from within sort of existing sort of practices. But I think the
Absolutely.
AI piece, because there's such a frenzy right now, is a real challenge. Halle, I'll give you an example. I hopped on a call the other day with a chap who's a chief innovation officer at a large healthcare system, let's just put it that way. And he sort of came in and he was clearly having a moment of consternation. And so I asked him, what's up? And he said, I've just been at this sort of nursing innovation sort of group that they have, and they foster and reward and lean into and like dedicate resources to internal innovation. And he said this nursing innovation sort of committee has given us some of our best innovations over the last few years. They see everything in the healthcare system, but what they just pitched, and they'd even gone out and sourced a variety of different sort of vendor solutions as options, was an AI solution to prevent falls in the hospital. And his point was, we know exactly who is going to fall in the hospital. They are all wearing a wristband. But the problem is, it's not that we can't identify them. It's that the built environment of the hospital means that we can't get every patient who's at risk of falling right next to the nurse's station. That by definition, and I am guilty of this as a patient too, you think you're fine. You think you're going to make it to the bathroom. And it's only when you're trying to make your way back that you realize that you're exhausted and you're not good on your feet. You're not wearing the socks, whatever it is. It's not an AI problem. And so I do think in this moment where everywhere you look, there's a conversation, as you said, there's executive pressure to sort of get an AI strategy, whatever that means. Surely it's just your health system strategy. And I think that's why things like the playbook that we did on healthcare AI implementation in your book is so important. I think about the smart shot description that you have. Right? How do you actually get to the heart of the matter and figure out whether technology is actually your friend in that moment?
Yeah, I love that story because you can just like see if they were really trying to solve people getting hurt from falls, like you would put maybe playground flooring on the floors. I mean, the solution is like so low tech, but yeah, I agree. Sometimes you just feel like there's less thought into the problem and more excitement about the solution. So smart shots, trying to force these like easy solutions into healthcare has over and over again shown us that you will waste time and effort. And so in the book, I help innovators think about finding what I call smart shots. And these are wedges where a few things are true. So one is that there's a genuine need. So you've like identified and verified that the need is there. Two, that technology or new care models can actually make a difference and be the solution, not the exact solution, but knowing that there is a solution that is technology and new or like a business model change, because sometimes it's really regulatory. And as the startup founder, like you can't go up against that. So you need to make sure that the regulatory and incentive environment allows for change to take hold today or soon. Because even if you feel like the technology can make a difference, if the policy doesn't align with that, then you're dead in the water. And then lastly, like really making sure that you can build something that's sustainable, scalable, where the margin and mission align. So kind of just like an easy, quick framework for finding what I call a smart shot. But I will say this, I think, for folks that want to start a company, it almost like searching for that problem usually isn't the right approach. Like the problem will come to you. You will not be able to stop thinking about it. And that's when you know you should go for it. In business school, there's a big, push to like find the problem in business you want to solve. But I don't necessarily think that's the right way to do it because you're not coming at it with the sort of like genuine personal incentive to solve it. And so when you have a firsthand experience, those are the founders who kind of come at it. They just like can't stop thinking about it. They like obsess over the problem. I need to solve this. I need to solve this. And that's when you know you're like, aha, this is an area where I can spend the next decade of my life building.
And Margaret, I see you smiling as sort of Halle describes that, because of course, these are the sort of brave innovators that you come across every day and that you sort of partner with to guide them to success. Halle, I could chew your ear off and sort of pick your brain for hours, but I want to make sure, Margaret, that if you have questions, you have the opportunity to ask. And you also bravely volunteered. We've got some tremendous questions coming in from our audience, and you are going to field those for us. So Halle, I'll thank you properly when we move to wrap up, but Margaret, let me give the mic to you to sort of guide the rest of our discussion here.
Thanks, Jen. And that was a great discussion. There's so many nuggets of insights. You talked a little bit about business model innovation, which we think a lot about, and the kind of like can't eat, can't sleep, got to fix this problem founder.
Yes.
Founder market fit. So I love that. But yeah, it looks like we have a couple questions from the audience. The first one is around just kind of the regulatory barriers for AI solutions, which, I think we think a lot about as well. And, the question being, in Europe, where this audience member is, they're seeing very high regulatory barriers, taking years to get fully validated, safe tools to market. And so there's this in-between time where clinicians, patients are trying solutions that may not be fully validated best practice tools. And so I think curious to hear kind of your perspectives on kind of what do you think will play out? Do you think those solutions that may not be fully validated will gain steam just because of the engagement with them? Or do you think there'll be more pressure to kind of like rethink some of the regulatory barriers?
Jennifer, you want to take this one? I know you've thought a lot about this.
So I think if we move immediately to try and replace anything, we're going to meet an unnecessary amount of resistance. And I'm going to go back to how Halle sort of described the smart shot, which is where do we see this opportunity where there are technologies that are already sufficiently mature, where we see a broken part of the system, where we're going to see a lower resistance to change from across the sort of holistic stakeholder group. And then, as we look at regulation, I think one of the things I think about often that we seem to have somehow forgotten when it comes to AI is regulation, whether it's in healthcare or any other industry, follows innovation. No one has set the perfect set of rules on autonomous vehicles, nor have they set it around how we need to behave in the oceans, nor have they set it around space junk. We're trying to get data on the problem, and then we will appropriately regulate it to keep the problem and the tools and technologies and the practices that we are trying to use and optimize them for safety and effectiveness. And that is true in healthcare and every other industry. I think sometimes we sit here sort of surprised and scratching our head that, someone at CMS or ASTP ONC or FDA isn't sitting there in their ivory towers secretly with all of the answers to all of our questions. We're ready to sort of decree it from on high. I think that the reason we have our federal comment toolkit, the reason we do all of this collaborative work here at Dime, Halle, the reason that your book is so important to serve as a guide around best practices is we need to have a North Star in our industry that we are here to care for people, that we are here to make sure that we do no harm. And that if we keep those things at the forefront of the mind, we have to continue to push. We have to continue to, innovate. We have to continue talking to our government colleagues who are putting out RFIs at sort of rates we haven't seen, seeking input. And then we have to trust that the regulation is going to support great innovation and cures for sort of, for patients, which is what we're here to do. So, I do think we're moving really quickly in this vein, but I think regulatory can be a really easy scapegoat, and I'm not sure that it serves us.
Yeah, I think patients have led so much of the policy change and just like the current movement right now. I mean, healthcare costs are unsustainable and people are starting to take action and starting to do things like sue their employers for mismanagement of their healthcare funds. And I have a whole chapter about kind of the consumer uprising. What I would like to see is that consumer uprising to match with the provider uprising that we're also seeing. Because if those are mismatched, then we're not going to end up anywhere that's productive for anyone. And I will say, when we saw the way that the healthcare system adopted technology in COVID, from virtual care, remote
Yeah.
monitoring, et cetera, we were all so excited, but we thought it was just temporary, right? We're like, wow, look at everything they've done in such a short period of time. This would have taken a decade otherwise. But we were all like, but it's probably going to stop there. Well, it actually hasn't. And these hospitals, and other big players in the space, like, they built infrastructure and tools and proved to themselves that they can do it, and that technology isn't their enemy. Technology is their friend, and that they have the capacity, the capability uh, to build new tools internally, partner with external companies and bring them in. And I think the fact that we've seen this year that 85% of hospital healthcare AI spend is with startups is incredible. Startups,
Mhm.
it was impossible to sell into a hospital a decade ago, and now it is. So I'm very hopeful that the way that the health system is now moving so much faster than we ever imagined, and we
Mhm.
simultaneously have a patient uprising where people are like, I'm just going to do this myself. I'm going to go do the full body Pronuvo scan. I'm going to do a function health test. Like, we have
Mhm.
demand for people to just get it done on their own. But I want to make sure that these two things are aligned, because if we're aligned, the patient as a stakeholder, and the health plans the stakeholder, and providers the stakeholder. Maybe health plans won't ever be aligned, but if enough of us are aligned, then I think that we can really change regulation. The problem is
Mhm.
we have so much regulatory capture in healthcare that the ones who are donating the most to politicians are going to continue to sway policy in their favor. And so that's what I'm concerned about. But if we can align them with patients, then maybe that's not such a bad thing.
Mhm. Yeah. That's great insight. And I couldn't help but think about the stat. I think it's like 2/3 of physicians are now using healthcare related AI, which is,
Yeah.
80% increase from a couple of years ago. So it's pretty wild to think about that. But I know we only have a couple minutes, so I'm going to keep us moving here. We got another great question from the audience around just the importance of lived experience in their own work. And Hallie, I think they're curious to hear if you've seen a similar trend with companies you're working with, which is focused around activating kind of a council of people around a company, whether that's clinicians or nurses in the example we talked about earlier. Just curious if you've seen that in some of the companies you're working with as well.
Yeah, absolutely. And I talk about that a lot in the book, just like the importance of your company looking like the people you're trying to serve. And there's a lot of ways to do that, from putting together councils to just making sure that your employees have the lived experience, that they know what they're talking about. When you see my one of my favorite stories is this company from Germany called what was it called? Pinky Fingers. They created pink gloves for women to safely and hygienically remove tampons. And like, just like, what, it was three males that pitched on like the German Shark Tank, and like, what riches of embarrassment there. Because they didn't, like, if they ever had asked a woman, like, first of all, do you need help taking out a tampon? Is a tampon not, does it not have something built in that you can pull from? They would have known very quickly that that was
Yeah.
not a real problem. And then not only were they chasing the wrong problem, that was a problem in their head, but not in reality, but then their solution was like single-use plastic pink gloves, like, could not be more stereotypically bad. And so that is like, that
Great
is what goes
example.
wrong when you don't bring in the people that you're trying to serve. And so you have to just do the opposite of that. Like, make sure that like it is from its core built by the people who you're trying to help. I mean, it's such a no-brainer. I mean, I can't even believe these words are coming out of my mouth. Like, of course you need to do that.
I think it's a great piece of advice to end on, which is one, if you are an outsider, which you described earlier, know that you're an outsider and you're going to have to kind of navigate that and, kind of like weed through the advice that you receive and just keep kind of your head high. But also think about, how do you surround yourself with the people that deeply understand the same pain point and like can help you push the product further, the solution further, and maybe not get build a business that may not actually be solving the real need. I love that example there. And I'd say at Flair, we're seeing a lot of, I think, just real uh, experts around the table that maybe not full time, but they activate at their customer site. So, for example, there's a great nursing company called that's focused on kind of nurse staffing solutions in hospitals called M7, and they have kind of nurses around the country that are kind of carrying the M7 flag. So it's really cool to kind of see that being activated across the country. So I know we're tight on time. So Jen, I will pass it back over to you, but great discussion, a lot of good nuggets here, and really appreciate the time, both of you.
Thank you.
Margaret, thank you so much for guiding us through a packed hour today. Halle, thank you for being here. Thank you for your leadership, really setting the bar for how, insiders can and should step up to support all innovators, because we're all here to improve people's lives. Congratulations on the book. We'll make sure that everyone who registered gets the link to pre-order. I loved it. I cannot recommend enough that we should all have it as a go-to sort of guide out on our desks at all times. And I also want to thank everyone in our community for your support of our bold vision for Healthcare 2030, the way that you show up to our projects, the way that you show up as part of our community. We couldn't do it without you. And speaking personally, this has been a hard year for me, but in so many ways, it's been so inspiring. And many of those moments map back to all of you and the efforts that I see you making to improve the patient experience, the clinician experience. Please don't stop. We can't stop. We have to keep driving towards that massively better future of healthcare. If you're not involved with Dime yet, hopefully our discussions today have inspired you. There are ways to connect on the screen, but otherwise, Halle, Margaret, thank you for your partnership, your leadership in our field, and thank you everyone on the line for, can't believe I'm going to say it again, a great year in 2025. Thanks, everyone.
Thank you so much.